So thoracentesis can be life-saving. When you have a dog or a cat with air or fluid in their chest cavity, it's very important to know how to do a chest tap so that you can relieve their chest of the fluid and air and they can re-expand their lungs. The tools that you'll need for thoracentesis include a larger sized syringe, a 3-way stopcock, a long 22 gauge 1.5-inch needle, an extension set, collection tubes including a purple top for cytologic analysis and a red top for possible culture, and sterile scrub and alcohol for your prep. The landmarks for thoracentesis first include putting the patient in sternal recumbency and pulling the right leg forward. You're going to palpate for the last rib, and you're going to do your chest tap between the last rib and behind the front arm, about halfway in between those two locations. In addition, you're going to want to go right in between the chest cavity, measuring from the dorsum to the sternum, right in the middle. Remember that the chest cavity doesn't go from here to here, but it goes from here to here because of those apaxial muscles coming off of the spine. So really, if you go about halfway in between from dorsal to sternal, you'll be in a very good location to obtain fluid or air. The next thing that you want to do is shave a small square area. And prep the area sterilely. After your aseptic prep, you're going to take your syringe, place the stopcock on the end of the syringe, and make sure it's a very tight connection. And then you're going to take your extension set and place it on the other side of the stopcock. Now remember, when you're working a stopcock, where it says off is what is closed in the system. So in this position, the syringe is open to the extension set and the needle. When putting the needle into the chest cavity, you can close off to the dog so that air doesn't go in, but because this is a closed system, you can just keep it open to the dog and not have to worry. You then put your needle on the end. Again, you want to make sure there's very tight connections so there's no air leakage. And you're going to need to palpate between two rib spaces. Now remember that the artery, vein, and nerve run caudal to each rib. So when you put your needle in, you're going to want to take your finger and palpate where the intercostal space is and try to go right in between the two ribs. And sometimes that's hard if they're small dogs or cats, but if anything, you want to err towards being a little bit more towards the caudal rib to stay away from those vessels and nerves. Once you find your location, you're going to take your needle, and again, if you're getting air, you could go a little bit more dorsal, and if you're getting fluid, you could go a little bit more ventral. And you're going to find your location in between the two rib spaces, and you're going to go into the chest cavity with the needle of the bevel facing down, going at a complete right angle to the dog or the cat. Slowly put your needle in, and then you're going to hang on to it because you don't want it moving around with inside the chest cavity, and you start suctioning the air, the fluid off the dog. A lot of times it's helpful to have somebody suctioning while you're hanging on to the needle so that you can assure yourself that the needle is staying in one location. Sometimes you don't get fluid, so you can back out a little bit or you can redirect a little bit more ventrally. Once you start getting fluid and the fluid is drawn off and the lungs start to expand closer to your needle, what I recommend is actually angling that needle down within the chest cavity so that you're not completely at a right angle when the lung starts getting closer to your needle. So you're going to angle down just a little bit. You should still be able to get air or fluid, but when the lung gets closer to your needle, you'll have less of a chance of lacerating the lung. Once your syringe has filled, you turn the stopcock off to your patient, and then you have a collection bowl or a graduated cylinder where you can push the fluid out into that bowl. Don't forget to get your sample. So you put the fluid in your tubes and then empty the syringe into the bowl. Then you open back up to the patient and continue suctioning until you get negative pressure.